Nikita here from Bezat, and we've arranged this session today for Iowa. We have Dr. Andrew with us here from Health Bay, and he'll be leading the session today on ergonomics. I think that will be an interesting topic for all of us and quite relevant to our daily lives, be it at work, at home, even in the car maybe.
What I wanted to say is this is actually the end of the presentation. I want you to use your time always wisely and successfully, like this bears from actually Dubai, they are showing here us that time is important. So I want you to focus every time that you sit on the way, how do you sit? And I hope that this time that we just spent together was good and that was successful for your health, and also to share with your friends. And now, of course, questions, if there are any questions, let me know. I'm very happy to answer your question. Nikita, how did you like the approach they took? I think it was more into sports and movement rather than, you know, just only in the office. So sometimes I want to take people out completely from the office to think about how to be good in the office.
No, absolutely. And I think if we are conscious of that throughout our daily activities and not just in the office, then we're overall conscious about our posture in general. So it was important to focus on it just outside of work as well, especially on our phones and when we're at home, and like you covered, when we're outdoors or even in the car for that matter. I have a question if nobody has.
They will have questions. No worries, just go ahead, you first.
Okay, great. I actually did have a similar issue where I used to have neck spasms, but that was because of overuse of a muscle. So I used to drive my car with one hand. So is that the same as not using your muscles enough? Because that also causes a lot of tension in my neck muscles and then a shooting pain up my neck. Yeah.
Very good question. It's more about overusing instead of using. Basically, you overuse probably your one side. So that time when you use one side only, you use more muscles on one side, then basically you put more tension over the muscle fibers. So these muscle fibers, they are always tense. And because of that tension, that might maintain even a small, tiny inflammation that creates the pain and tension again. So it's a vicious circle. So definitely using two hands, be more using both hands is a good idea. But maybe changing the position, maybe changing the way, how do you hold your hand? Maybe your elbow can be supported. Maybe that's the thing. You know, in the middle of the class, there's always the tissue box that we can put actually elbow on, or maybe you can support yourself on the on the window. But definitely using just one hand, it's straight idea actually to have a pain. Yeah, so we should be more symmetrical.
That's very helpful. I have one last question. You spoke about active and passive forms of treatment recourse. Is heat therapy, so like using a electric hot water bag or even ice therapy for that matter, as useful or effective when we're treating any sort of pain or want to bring down inflammation, or are exercises enough to kind of
That's a big topic actually. Basically, we have to know that if you use something which is hot or warm, that's very good for releasing the muscle tension. Okay, so this we have to remember, but it's not the best for the pain. For the pain, we should use something cold. So basically, the pain or the swelling, we should use ice. Yeah? If it's just a muscle tension, we should use something hot. So this is one. And what was the other part of the question?
No, I think that was it. I think you answered my question. So I guess then pain management and actual relief, I mean, actually working on your muscle is different. Yeah, I think that's about it from me, but you answered my question.
Therapist, we don't prescribe any medications. We are not allowed to prescribe any medications. And honestly, I don't know much of the medication. This is not my part. So that's why we have different natural resources. Yeah, I can see Priscilla sitting in front of us. How are you, Priscilla? Can you hear us? We cannot hear you, but I bet you might have some questions. You're on mute. So if you want to ask some questions, then more than welcome.
How was your holiday?
We still cannot hear her.
I think your mic isn't working, Priscilla.
We can see also Mr. Ramesh, Chetri.
Andrew, not a question actually, but I recently I basically suffer from cervical and it's been there for quite a few years. And recently, there was a shooting pain that had been increasing, for the past couple of months. So I did go to a doctor and got an X-ray done. And the diagnosis was that, there is a bit of a compression and stress in disc 5 and 6. Obviously he prescribed that I do some kind of exercising, and I have obviously started with that, and, making sure, like suggested, that, taking breaks every 30 to 45 minutes to just walk around a little bit. I started wearing a Fitbit just to make sure I do enough steps in the day to be able to do that, because otherwise, you're glued to your chair, right? But when you said all of this, which is, I think the text bit, which is using the phone, is that which leads to cervical, or is that connected? Because he obviously suggested, the doctor even suggested I do an MRI, but I've not gone for one yet. I don't really know if anything is going to change, because he obviously prescribed some medication, which were mainly painkillers. And what I typically do is, when I get a lot of pain, is again do hot fomentation, because that kind of does give me some amount of relief. And obviously now I'm obviously following some kind of a routine around, making sure I hit the gym every day, at least 4 times a week. I do my steps, and that's what I've been doing. But is there anything else that I'm missing out on, which you probably would advise me to take up?
Very good question. Very good question. So that sounds for me like a very mechanical problem, because compression is mechanical, and by basically leaning forwards, you're putting mostly the biggest amount of pressure over the lower part of the cervical spine that you actually mentioned just a while ago. So I think definitely start with the exercise that I showed, please, the double chin. There's no harm doing that. This is one. So basically, when we strengthen the core muscles of the neck, first of all, the posture is better, but this is not the most important thing. The most important thing is that if there's any compression of the disc, sometimes the discs, they might slightly move left, right, and they might sometimes, push more on this nerve, sometimes more on that nerve. But when we have a stronger core muscles in the neck, it's like the muscles, they contain and they stabilize even the compressed disc more. So there's not much of chances that the disc is moving that much. Yeah, it might initially, yes, it might give you some pain because it's something new, but basically it's more of containing and holding in one place the disc. So that should definitely decrease the symptoms, especially like radiation or numbness. For that, there is also something that we use strictly as a physiotherapist, and we share this with patients. We do neuromobilizations or neuro stretches if there is a level that you have a numbness. So maybe worth to have a look at that, the neuromobilization or neuro stretches. We're very happy actually to help it and show it live. But I think these two things, they are important. That's mostly what I do. Other thing would be also something that we cannot do that much ourselves is the traction or distraction, is basically improving the space, increasing the space between vertebra, and this we can do by some manual traction. So when I have a patient, I had a patient yesterday for the neck pain, so I was able to basically slightly pull and release the tension of the disc, and that actually immediate that you can feel. Plus, obviously, this what we've been doing is good. It's good. What I would suggest, maybe focus also on stretching of muscles, because sometimes when we have pain, we have also a lot of tension in muscles, and we still have tension in muscles, so still we have pain. So it's a vicious circle. But when we stretch the neck, sometimes it releases as well. Yeah? So, but then again, the question is how much is it compressing the nerve? Because sometimes stretches, they might unfortunately give a bit of more of the numbing sensation.
Sure. And is it advisable that when you sleep, probably, you get these pillows nowadays, right? Which have curved, I don't know what you call them, but do you advise that one use that if they have, say, like a neck pain of my kind?
Yeah. Something that I didn't cover, and thank you for recovering, let's say this, and bringing a good question. Neck pillows, orthopedic pillows, absolutely good idea. The only thing is that if people, let's say some people, they sleep in front on the stomach, then they are kind of useless. If you sleep on the back, they actually work very well, but they work only very well when you pull the pillow all the way to your shoulders, because sometimes like this, let's say I have a pillow, give me a second. Let's say that's my pillow. It's quite big on this thing, but imagine I keep it, I'm lying down on the back, and then you see the space between the pillow and my shoulders, right? This is wrong. The pillow has to be all the way back. It should really support. Yeah, this is one. So even normal pillow shouldn't be actually, you shouldn't sleep this way. You should sleep down. This is one. Second thing also with, especially lying down on the side, you should also keep the pillow all the way down. It shouldn't be like that gap, that shouldn't be there. Yeah, because then you even actually go hard. So this is first of all the idea about how to keep the pillow, and plus the medicated pillows, orthopedic pillows, they have this nice curve that actually really supports the curve of our back. So good idea. From the practical point of view, choose the pillow which fits your mattress. Sounds a bit funny, but the reason is if you have a very hard mattress, then you should have actually not that high pillow. If you have a very soft mattress, some people they have, the pillow might be a bit higher. Yeah, so that's
okay. Yeah, thank you.
All right, so I think these are the questions. All of us with 18 people. That's good. I wanted to just say this funny story what happened, because I love to sail. You saw me sailing on the boat.
I was just about to ask.
What happened was I'm a huge fan of sports, and sailing is a beautiful sport. If anybody wants to know more, then I'm more than happy to share with that and invite to my boat. But what happened, I took actually a very good friend of mine, and because the sun was super strong, obviously I had my glasses, and I always protect them not to let them go, not to lose them. So what happened, unfortunately, we capsized with the boat, which happens sometimes, but this time I lost my glasses. So definitely I have to actually get my new shades. Then I'll be able to actually sail even better. So that was the whole story about what happened when you sail in a way that you want to actually share the knowledge. So by sharing the knowledge, I hope that I gave you some new ideas and more understanding on how to be more ergonomic in the office.
I'll pass it on to Dr. Andrew to introduce himself and begin the session. We'll also be recording, so if anyone needs to refer back or needs to connect with Dr. Andrew offline, we can even maybe arrange a session at the clinic. And then we can, I think, take questions just after we've finished, or you can leave your questions in the chat box below. So I hand it over to you, Dr. Andrew.
Hello, good afternoon. I'm not a doctor, I'm a physiotherapist. That's a small difference, but always just say about this. We as a physiotherapist, I hope you can hear me well. I hope you can see me well.
Yes, we can, thank you.
So we as a physiotherapist, what we do, we basically assess how people they move. We don't assess how people sit that much, although of course it's a part of our work as well. So we treat not with medications, we treat with movement and different kind of approaches which are connected with the manual therapy. So that's what physiotherapists do. What's about me? My name is Andrzej, or Andrew. It's easier to actually understand my name. I'm from Poland. I've been a master of physiotherapy since 2005. I used to work in Poland, obviously. I used to work in California. I used to work in Germany. And since 2009, I'm taking care of amazing people in Dubai. Even I had a chance to learn Arabic, but we're not talking Arabic right now. I'm super happy to be in front of you working in Eyewa. Strong and important company, especially for me, as I said, because I do wear glasses as well. So I know that vision is super important in any kind of work, especially working in any kind of the office environment. So I am going to talk about the successful day at work. And I hope all of you've been having a good day, but it might be even better because of the knowledge that I'm going to try to share. Definitely, we're going to talk about ergonomy, and we're going to have more questions, but towards the end. So I would like to start a bit with the twist, because we have to wake up, and maybe you had a busy day, and let's refresh. So all of us, we love to spend actually holidays somewhere when we have good health and we're actually ready to be 100% sure that we have good time during holidays. So how to do it? Probably to take care of yourself when you work hard and so on. So if you can see, there's some very strange picture. That's me actually, because I love to dive. And whenever I take and think about my health, I always think about my holidays, that I can actually enjoy my holidays when I'm really actually taking care of myself. So for people who sit in the office a lot, we have to talk about the improving of work ergonomics and how to take care of this. And then if we're good at work with ergonomics, we can think maybe also about our holidays. Why not? So this is me. I work in a few different places, but I'm always with Health Bay. This is the picture from Motor City. This is the place that actually we recently opened the clinic as well. So if somebody's in Dubai, we can also see you in Motor City. And the question is, are we the neighbors maybe? So currently right now I'm sitting looking at Burj Al Arab because I'm sitting in this place, which is in Al Wasl Street. So that's a place for physiotherapy and orthopedics. And Motor City is the second place where you can see us for physiotherapy, just in case if there is a need or any kind of requirement. We have obviously different kind of services as well. But let's go back, let's stick to the topic. So let us talk what is the work ergonomics, how to sit in the office, car, or even motorbike. Sometimes they ask these questions. We'll talk definitely about common pains and problems. We'll go through exercises. If you're interested, I can show you something live as well, although would love to actually sit in front of you and show you this. And we're going to incorporate the foam roller and stretches, neck active exercises, eye exercises as well, especially for you. And then probably the most valuable part are the questions and answers. So Q&A session and problem solving. So why shall we follow ergonomics? Yeah, to be more efficient, at work, to do the same work, but in a better way, to minimize the sick leave usage. So we don't want to go for sick leave, but definitely better to enjoy, as I said, holidays rather than use the sick leave. And then definitely to have a good results as a team. So the team is strong, we're better, and we can perform better. So the question is how to improve the work ergonomics. I hope you can all hear me. So to influence ergonomics at work, what we have to do, or what might actually implement the situation that influences the ergonomics. So that's definitely the repetitiveness of the task, of the movement that you do. Let's say imagine about the mouse that you use every time, now and down, now and then. That might be also a change of the body position due to work. So imagine you're always sitting rotated to one side and you stay in that position, but also you have to change it sometimes. So that might influence the ergonomics of work and the way how do you feel. Amount of rest, remember that you should actually relatively often relax and stand up from sitting all the time. So that should be a good half an hour or maybe 45 minutes, and then stand, stretch yourself. We'll talk about this later. Then what influences the ergonomics at work as well is the range of motion that you need to actually do that certain task. Yeah, I mean, this is more for purely people that they carry heavy things. So I believe we don't have many of those with us right now, but that's also a good idea to remember about this. And then the simple fact how our body is built. So that also gives the idea how the ergonomics might actually be implemented at work. And what are the most common symptoms that we have problems with, and if there are any ergonomic issues? So let's say that might be any kind of tingling, numbing, stiffness of the muscles, joint stiffness, swelling, decreased range of motion. Sometimes we have decreased grip strength, talking again about the mouse, but also especially for Iowa, we have to know that also the blurred vision or watery eyes or such kind of problems, that might be the issue. So we have to also work and think about our position of the head, obviously also about the eyes and glasses as well, but that's also a part of ergonomics. So let's do a small, very tiny quiz. All of you will answer it yourself. So that's a self-assessment. So the question is, do you have a pain during sitting? Some of us we have. The question is, how often do you have it? So is it less than half an hour? Is it less than 1 hour? Is it sometimes, or there's no pain at all? Obviously, we're having better ergonomics if there's no pain at all. Yeah, so that's one thing. Stretching routine that actually all of us that we work in the office, we should actually do. So how often do you stretch? Sometimes, like seldom, twice a week, once a day, a few times a day. Obviously, the direction is few times a day is a good idea. And this is actually a proper way. And then talking about sport activities per week, let's say, I mean, that's per week, but I wrote once a month, maybe once a week, twice a week, every day. Obviously, probably we're more advanced in ergonomy in the office as we do sport activities more often. And what I would like to say today, topic is about ergonomics, but actually I want to push you a bit more towards understanding that ergonomics is important, but actually movement is more important even. Yeah. So what is the amount of sport activities that you do to take care of your back, of your neck, of your wrists, of your shoulders. That's important, not only how do you sit, although we're going to focus on this most. So what is the perfect sitting position? Everybody's always asking, and there are so many answers, like so many questions. And if you don't mind, because I like to do it a bit with the twist to wake you up and keep you just interested, let me show you this question, this picture. So you might be surprised because this is not a guy who sits in the office. By the way, this is me sailing on my sailing boat. And for those who is still till the end of the presentation, I will share some funny story. But what I want to show with this picture is if you sit very stable and you might become very stiff, this is one thing. But if you sit and you do a lot of different movements like this sailor is doing, then you see that there is still sitting activity, but it's different to sit still when you have a laptop in front of your desktop, and different when you sit on your bike, motorbike, or on the boat that you continuously have to use your body to move left, right, forward, and backwards. And that's why the idea also of sitting on the ball is a good idea. So that was just the question, what is the perfect sitting? So the perfect sitting is basically the one that you not only sit, but you move a bit within that sitting. So what is the perfect position? For how long can you keep it? So everything depends from the postural muscle strength and the endurance of muscles. And this is so as that, of course, as you look at this gentleman on the right-hand side, he's sitting nicely, he's very eager to sit straight, but probably as he's focusing on the project that he's working on, or maybe talking with somebody in the room, he's naturally more focused on the talk rather than the way how he sits. So basically he's collapsing and going more into the passive position. And that comes because probably some of his muscles, they are not that very strong, or maybe he didn't actually work on the muscles that they would keep the upright position. But this is natural thing that we're slouching. This is natural thing. It's more about to be aware of this, that we might be slouching. So definitely we have to work on the postural muscle strength and muscle endurance. And both of these things, they help us with maintaining better position. So if we have postural muscle strength, that is worth to actually work on also every day, and good endurance of muscles, then we don't have to think too much about ergonomics, because muscles, they actually take over, and then they can help us to decrease the amount of slouching, let's say. Yeah, this is one. So why do we slouch? And the studies basically, they show that we mostly sit about 8 hours a day, and this is a risk factor of sitting for a long time. So definitely sitting all day long is wrong. That's why we should do actually breaks, which are like good half an hour, 45 minutes breaks. And that's a risk factor because we had the prolonged weight loading. Yeah, so of course we are created to load our weight when we sit, but not for too long. So that's always the hard part, and that's why we have to stop from sitting all day long. But we have to realize that it's good to stand up, stretch, walk a bit, take a healthy walk. So why do we slouch? That's a question actually. So the answer is that we slouch because we can. That's maybe a strange answer, but that depends from our mobility. If we have a lot of joints and they are created to be mobile, that also gives us the possibility of being in a wrong position, but also good position. So when we have going back to the muscle strength, we have less muscle strength, or they are not that good, or the endurance of muscle is less, then the joints, they are basically hanging passively on your own structures, and you're not that much upright. You're not maintaining the best position. But the reason why is because we have so many joints, and then it's important to take care of the mobility of the joints, but also of the control over the joints, and that's important. So in ergonomy, it's important to use the muscles that they control our posture and maintain it for a longer time. Yeah? And all of us will probably know that we have different kind of curves in our back. So next thing. So talking about the muscles again, we have something that we call posterior chain of muscles, that they are the postural muscles, and these all muscles, they control basically our posture, so keep us upright. Yeah, and then on the top of that, there is a gravity and the body weight that bothers a bit with using these muscles, and then make the muscles fatigue. So that's additional factor that actually keeps us more into the, let's say, neglected position, more into the position that is slouch, or we actually move our head and chin forward. So we'll talk about this after a while. So what are the tips for practicing better posture? So one thing we're going to talk about this right now is the ergonomic setup of the desk. Let us talk about this right now. So that's probably what that you are looking forward also to see. The way you sit, it's important. The way how do you position your body is important. The way you support yourself on the chair or the kind of the chair is important. So let us actually go through it fast from the actually not from the top to bottom, but opposite, from the bottom to the top. So first thing is that we should have our feet on the floor, and the floor should be easily reachable with our feet. So that depends from the level of our seat. Yeah, so how high is the seat, how low is the seat? Definitely our feet, they should be on the floor. And what is important here, the knees, they should be within 90 to 120 degrees. So this is one, this is important, it's easy to say, but also that depends from the desk setup. Yeah, like recently I had somebody who had a very high desk and wanted to maintain this position. So the position is still possible to maintain, but then you have to put maybe some small tiny block under your feet. Yeah, can you hear me, guys?
Yes.
Yes.
Okay. Just wanted to see what's going on. So that will be the one. Second thing, the way how to sit in terms of the flexion or extension of the lower back. This picture shows 90 degrees to 120 degrees. That's still very good actually range of motion. We might be upright, we might be actually leaning slightly backwards. And whenever we do this 90 degrees or 120 degrees of your hip movement, then our elbows should be supported and hands should be on the desk, or will be possible to actually hold the keyboard or operate the mouse in an easy way. So these are the things that are variable, although this is important to remember about these few things, that feet, they should be flat, but this is important, but more important is that the knee flexion should be 90 to 120 degrees and our back position should be 90 to 120 degrees as well. Yeah, that actually might complicate a bit of the positioning of the head, but the easy thing to answer is that the head should be the way that you can easily see the screen. Screen shouldn't be down too much below, it should be just in front of you. Yeah, so ideally, of course, if you work maybe on the desktop, that's probably easy to actually put the screen a bit higher. If you work on your laptop, obviously there is that a bit of deflection of the neck. Sometimes if people, they work and type a lot on laptops, what I suggest is basically buy the extra keyboard, connect it with the USB, and put the laptop basically above the desk level. So maybe you can put it on some small box or a support that your eyes are not only looking down and you're tensing your muscles of the neck, but you're also looking actually in front and you have the freedom to be in a better position. So that was the one. The next thing is about the distance for the screen position. So that depends, of course, from the setup of the desk, but that should be between 45 to 70 centimeters to see the shape or the size, of course, of the fonts or whatever actually you work on, maybe some graphics. And here, this is an important thing for people using glasses or taking care actually of eyes and the eye hygiene. What you can say, you should not protrude, you should not push your chin forwards just to come closer to the screen to feel like you really want to see the big fonts and big size of the text, because that will actually definitely give some tension at the back of your neck, and this is not advisable. So we'll talk about this, but the idea of having the screen too far definitely might provoke you to push your chin forwards, and this is wrong. Sometimes we see colleagues at work that they are really leaning forwards with the head, that they are slouching as well. So this is like a try that we'll talk about. So working zones, that's probably very simple. Of course, primary, secondary, third zone. The primary zone is the one that you have the most important things like your keyboard, mouse, probably that's the one. And the rest is less important, but still important for work. So other thing as a tip for practicing better posture is active breaks, strength and mobility. So that's more about maintaining this idea of 30, 45 minutes breaks in between. Try to stand up, stretch up, mobilize yourself, not just to be in the same positions. That might take even 1 minute, 2 minutes, but it's quite important from the point of view of ergonomy. And then external support. That's something that we can easily access in that big city like Dubai, for instance. So let us talk about external support that we can use for ergonomy. So, and what shall we use? So that's possible to be used in the office or even in the car. Some people, they drive also a lot. So start off with lumbar rolls, bridge mouse pads, sitting wedges, office chairs, spacious desks.
To connect to Barbara, speak And select the
Oi,
list.
can you hear me?
Yeah.
All right.
I think if everyone can put themselves on mute.
Yeah, exactly. Let me check it.
Great, I think we're good.
I think we're very good. Sorry for this. Let me go back to this. All right. I hope you can see that. So these are the actually external supports that we can use for improving the stability of our sitting, so to be more ergonomic. So lumbar rolls. What are the lumbar rolls? Basically, that might be even a towel, although in the office setup that would be probably a bit harder part. So we want to have something that in a way it will stop us from slouching. That's the easiest way to say. So basically you have a roll behind the back, as you can see that lady, and then she's not actually able to slouch. And the reason why is because she's having something that bothers to slouch, and this is a lumbar roll that supports her back, and basically even she's getting tired, it will not allow her to slouch. So this is a good thing. And as you see, the roll has also a strap around the chair. So that would be one thing, and probably the most typical thing. Other thing would be a sitting wedge, slightly more advanced or less, or often actually seen in offices. But imagine the wedge which is under your buttocks and actually is pushing you forwards. So it's kind of pushing you to fall over. Obviously, you're not letting to do it. And then this is the way also how you maintain the more upright posture, because you're not letting the wedge to push you forward. So you maintain the nice position by using your muscles of the back. So that's also a way how to sit better in the office. Sometimes, obviously, sometimes some office chairs, they have also this function to basically push and wedge and tilt forwards, and it's not a bad idea. The only problem with this, sometimes if we do it too much, our knees might struggle if we keep our feet behind the chair or behind actually the first row of legs of the chair. So that's why, again, let's go back to this, what I said again before, sorry, that we should keep the feet flat and knees, they should be more or less 90 to 120 degrees. So that's the way that you're not going to put too much of pressure over your knees. And next, keyboard and mouse ergonomics. First of all, I would say that using the mouse it's a good idea. Many people I can see that they've been using laptops and they never use mouse. They've been using only mouse pads, and I believe this is definitely decreasing the quality of work. I would say maybe 20%. You can improve your performance by using any kind of mouse as a mouse, not as a mouse pad. So this is one thing. Second thing, very simple. Mouse pads that they are supporting your wrist. That's important to actually maintain the nice position of your wrist and not increase actually the pain and tension over your wrist and fingers. So that's basically positioning. Yeah? So that's a typical external support that we can have, and that's basically around, I hope you can see the cursor, that just below your end of the forearm, just below your wrist. Second thing is the keyboard. How do we actually write anything? So you see that most important thing are the angles. You can see that they are a bit hard angles. So we should, when we type our angles, they should be almost even to 0. So basically wrist, they shouldn't be going too much to the inside, let's say like in this on the right side position, or the wrist, they shouldn't go too much outside as well. So they shouldn't bulk too much, because that will change the trajectory of the way how do we type. Yeah, so just always try to keep the natural support also of the wrist when you type and keep the nice angle. So what is in common that we have actually in ergonomics and wrong ergonomics? That might be definitely pain, weakness, limited position. And what decreases the symptoms? Conditioning and good muscle control. So you see, this is what I was saying before, that ergonomics is about angles and the way how to sit, and there may be some external supports. Yes, that's true. But for me, for us as a practitioners that they take care of people which having the back pains, neck pains, wrist pains, and so on, conditioning, which is basically strengthening, or good muscle control, which is connected with the functional strengthening, is important. Yeah? So when we have a good technique of movement, we have a better way of sitting. And that's maybe a main thing that I would like you to remember. Sitting is important, but also movement is even more important, because the better you move, the better you sit. It shouldn't be the other way around. Yeah. So let us talk more about clinical symptoms, where I believe like maybe halfway through already. Upper cross syndrome is just a fancy name, but I bet you've been seeing this maybe left, maybe right in your office. So you've been seeing people that they're having a heavy head, or the head is going too much forwards. It's a typical thing that we as physios we see here in Dubai, or let's say in any other part of the world. So the situation connects with the rounded shoulders, rounded back, and the fact that the head is going forwards, although the head should be more in the line with the shoulder line. So have a look at this picture. It's easy to say maintain always the nice upright posture, but if you see on the left side, the normal posture is the one that the shoulder line and the, let's say, ear line is more or less the same. But if you see somebody leaning forwards, slouching, going forwards, or hinging too much, then you can see the person on the right side. And what goes along actually with this is the fact that the head is heavy, but it's even way heavier when it's more in front. So it's like a vicious circle, honestly saying. It's a vicious circle in the way that if you keep actually going with your head more forwards, it will give you more pressure and tension, and then probably you will have to use and overuse muscles at the back of your neck, and that will create the pain. So what we want to do, we're going later to do some exercises against that, but you have to remember that keeping the head in line with the shoulder and the ear line with the shoulder is important. So whenever you see a friend who is having a wrong position, definitely tap the shoulder, or him or her, and then remind them about this slouch. So anatomy of the slouch, because that's what we're talking about right now, is that the head is going forward. We have shortened neck and throat muscles, so that might also give extra attention to the muscles. The forward rounding shoulders, this is not a good sign, because it's already the situation that we see that person is slouching. Tight chest muscles. Not further than 2 days ago, I had 2 ladies with breast pain. They went to do the mammography, and they were doing some ultrasounds, and what happened was basically they had the wrong posture, and the muscle of the chest and the muscle of the rib cage, they were so tense that they were giving actually the pain towards the breast, also even to the nipple, to be even more exact. But you see that the bad ergonomics also, they actually lead to the wrong position, and then tightening of muscles. And these muscles, they don't have to be only tight, but they also can give, unfortunately, and produce extra pain, which we normally call a referred pain, like a trigger pain, referred pain. Yeah. Next thing is the important part of current community and society, I would say. So all of us, we've been using mobiles. Mobiles are important. We should just know how to use them and how to not to overuse them, obviously. So there is something that we call the text neck. It's obviously not a diagnosis, medical diagnosis, but it's a typical thing that people, they come with the neck pain. So because they suffer a lot with the text neck, they use tablets or mobiles a lot, and they bend the head forwards too much instead of bringing the mobile up. Yeah. So forward head posture, and we spoke just a while ago about the whole forward head posture. It's increasingly common musculoskeletal complaint, and definitely that results in the pain of the neck and shoulders. And look at that also, especially among young people. So the question is it damaging our life or spine? Yeah, is it giving more pain? Yes, obviously. So here you can see that's actually written by pounds, not by kilograms, but you can see how much do you tilt the neck to give yourself actually much more pressure over your cervical spine, over your thoracic spine, when you lean forward and look at that SMS or WhatsApp. Yeah. So the suggestion would be to actually go other way around. The head stays in the same position on the picture number 1 on the left side, when there is 0 degrees of the neck tilt, and you basically bring your hands up. Yeah. So that might look a bit funny, but that might be actually good for your neck, and your neck and upper shoulders, they might actually be thankful to you that you are doing it this way. Plus, moving the mobile up is an exercise. Yeah. All right, here the next idea about the mobile as well and the posture. So you see the red one is incorrect, the green one is correct. Slightly, if you move that mobile up, that helps a lot. Or if you sit or you're on the lounge, you can use some support. which is really helpful, and that increases the quality of your neck posture. So that's a funny picture. I hope you can see that this gentleman is looking at the skeleton. He actually literally lost his head because he was using his mobile too much, because there was too much of pressure over the neck. So one day eventually that will happen. But how to avoid the text neck? That's a question, especially in common times. So is it unrealistic? It is a bit unrealistic unless you know how to focus yourself on this, what you do, and you bring your hands up. So the posture for actually good texting or using the mobile is when you keep your chest up, shoulders are down, and the chin is tucked in. So we're going to talk about this chin tuck. So basically when we have the double chin and when the chin is moved slightly backward. When we minimize the tilt of your head by lifting your phone up to meet your gaze. And then again, that's a thing about also glasses, that if you have good glasses as well, it's better to actually use the mobile even closer. And then when you adopt a good posture and the whole body is in a better position. Definitely don't cry your neck up, because otherwise you'll finish like the gentleman on the right side. Okay, so the next strengthening, that's an exercise that I would like all of you to do right now. And let me just change it to the video and we'll just go through it. Just a small information. This is a strengthening. This is not a stretch. This is actually the exercise that we do to improve the posture. So yeah. So the idea about, let us go through the mobile. So I have a mobile. Literally, that would be a good idea to hold the mobile this way, not look down and look all the way down, because that really gives a lot of tension in our neck. This I don't have to explain. So that might look funny, but I support myself with my elbows on the back, on the chest, and actually that's quite easy to do it. So please adopt it from today onwards. Yeah. And now the strengthening, super important exercise, super funny because people, they call it double neck, but it's also very effective. So what I want you to do, let me show you first the Prasanna. Okay, yeah, I'm happy for that. Let me show you first the wrong position, because pictures are pictures, but yeah, I think I can show it even better. So wrong position that I was talking about is basically when the shoulders are rounded and then our head goes forwards. Yeah. So imagine I'm typing this way, I'm rounded, this is wrong, but think about the neck. So instead of this position, my neck and head is all the way forwards. You see how far is my chin from the chest, I believe. That's easy probably to see. So this is wrong. This is correct. This is wrong. And probably people, if they want to come closer to the screen, they do it. This is correct. Yeah. This is wrong. So out of that, you can see that we can do the exercise. Yeah. We call it double chin exercise. So basically, you want to do this movement. So I would like you to focus right now and just try to do it. Yeah. Nikita, can you do it with me? Let's see it sideways. Yes. And then go backwards. You want to do the double chin. And again, you want to relax your head and then go backwards and maintain the position. Yeah, Nikita, very good. You're a great model. Show us again if you don't mind. That looks good. Keep going. Fingers that you are using, don't use them to force the neck backwards. Don't use them to force the chin backwards. It's just like a, you know, like a information for you that you're doing the movement. So I want you to actively use the neck muscles to retract the neck, the chin, to tuck the chin. And the thing is that you want to stay in this position for a good 10-15 seconds. Yeah, so it's not only moving back and forth. No, it's going once. Try to focus. Try to maybe do it for 10 seconds. Even you should actually do it, especially when you type, when you write, or maybe even right now as you're on the video presentation. That's easy. Even today, I had one lady from my country, from Poland, and she mentioned that she's been doing this when she stops on the signals. So whenever she drives, she cannot do it, but when she stays and she has, let's say, a good 1 minute, and that's a good time to do it. So let's carry on. So please remember about this exercise. It's one of the first exercises that we show. It's the exercise for deep core muscles. So all of us, we heard about core muscles of the lower back. Core muscles are everywhere, lower back, actually also in the neck. So this is the way how to execute the good way of strengthening neck muscles. So let me stop the video and start sharing. That's a very good model. She showed well how to do it, but Nikita showed also very good. All right. Talking about the mobile as well. I don't know if you use your if you use your mobiles a lot, if you use headsets, but definitely headset is a good thing. It should be used. Probably people, they don't use that much of landlines right now, but if yes, please do avoid. So avoid basically the position on the left side. So either use the headset or keep your neck straight all the time. Try not to keep the headphone against the shoulder. This is wrong. Yeah. Okay, something about you, and something I believe you can recognize the gentleman on the right side. That's a picture from your website. So visual hygiene is important. Definitely, you are the ones that you talk a lot, especially people that are actually in your salons. But what is consisted of? What consists of visual hygiene? So that's definitely a good posture. Yeah, visual hygiene is not that perfect if the posture is wrong. Yeah. Properly prescribed lenses. That's, you are the specialist with this, yes. And then also eye relaxation exercises. I believe you might even introduce it in your company for your clients, or maybe within your office. But I think you would be a perfect actually company to do it. So good posture. I believe that more or less you know a bit more about good posture right now. Proper prescription of lenses, that's your specialty, and eye relaxation exercises. So many of us, we know that basically to relax your eyes, you can of course rub them, relax them this way, but this is not what I want to talk about. I want to focus more of the eye relaxation in terms of massaging muscles around the eyes. This is one thing. Second thing would be basically using your eyes, because all the time, let's say we are sitting in the office, looking at the screen, which is relatively close by, but yes, we do have muscles around eyes, so we can actually use these muscles as well. So believe me or not, I'm sitting in Al Wasl Road in Dubai, and I can see amazing huge Burj Al Arab just in front of me. So if I would sit all day long like this and type, I would probably remove my glasses and look at Burj Al Arab far away. So my eye accommodation will be slightly different, and then I would maybe look at my nose and then again at that place and so on, because it's so far away. We can accommodate in a different way. So eyes, they are actually doing exercise. You can say you stretch your eyes. Yeah. Next thing would be problems and syndromes. So we spoke already about upper cross syndrome. So that will be that situation that the head is going forwards. And this is very typical what we see, and that requires physiotherapy. We have also problems like scoliosis because of wrong sitting, or maybe it's inherited. We have also problems with wrists, let's say like carpal tunnel syndrome, and obviously low back pain. So scoliosis, just for the idea, carpal tunnel syndrome, that is mostly connected with either weakness of your hand, like you have a very weak grip, maybe some of you had it, maybe you had some numbness or tingling. This is very typical. Maybe your wrist getting swollen. That's something that we can definitely work on. Low back pain, that's more about, you know, the way how do you sit. So you are given the ideas how to sit properly or how to use the additional equipment to actually sit better. And then the question is, from my perspective, is the treatment, which treatment is better or more effective? Is it the active or passive treatment? So just to let you know what does it mean is, passive treatment means massaging somebody, and active treatment means creating some sports program in terms of the strengthening. And active is way better than passive, unless we're in like a severe pain. And that actually refers to back pain, neck pain, even wrist pain. Yeah, postural exercises, which are again exercise, which means movement. And then we'll mostly focus with this active treatment on intrascapular strength, so strength between your scapulas, and improving the mobility of your thoracic spine. And that leads us to the practice time. So let me show you some pictures, and then very soon we're going to have questions. So you can absolutely ask me anything. So practice time, that will be mobility, and that consists of foam rolling and joint mobility. Flexibility is purely for muscle, and that's actually supported by stretches. And strength, that improves the control of the posture, that you can improve by exercises. So let's start with the thoracic rolling, which is a kind of a mobility. Because you sit maybe for too long, you feel that the lower neck and the upper thoracic area is so stiff. So why not to try to do foam rolling? Okay? You can do it at home. Maybe you can do it in some, like, let's say, stress room that we have sometimes in offices. It's a very good thing. There's plenty of information how to do it on YouTube. So just type thoracic rolling and that's the way. Then we have also the area between scapulas, the intrascapular area. We can definitely use some trigger point balls because quite often we have a lot of tension in the muscles that is quite often it's actually trigger points. With these trigger points, we can do many different things, but by yourself, you can definitely either stretch or use the deep tissue release. Buttock, also important part actually, because you sit all day long, you might feel tension. Again, the same kind of situation idea. The trigger point balls, they help a lot to release. That might be also actually the foam roller, but I think against the wall, as that lady she's saying, that's an easy way to do it, especially in the office. You don't have to lie down on the floor. Yeah. So the next thing, strong muscles. That means better posture. We don't have to remember how to sit properly. Muscle do it for us. So that's basically again the idea of being active. If you train your muscles, then you don't have to be super aware of your posture because the muscles, they are well trained and they maintain the nice posture. Yeah, so it works this way. So definitely gym fitness, conditioning with the good technique is also the way to improve ergonomy in the office. So, but just to give you an idea, what would be the strengthening is this kind of postural strengthening exercises. Yeah, many of us, we know the bridging. So this is the gentleman on the top, when you basically move your hips up and maintain your hips. That works a lot for your quad muscles, your buttocks, your upper back, lower back. This is actually everything that uses muscles that we don't use much when we sit. When we sit, we mostly slouch, we lean forward. So the muscles of our back, they are overstretched, correct? So this is the way that we can actually nicely strengthen these muscles. All kind of rowing is helpful. Overhead press-ups, good idea. Upward rows, good idea. Pull-ups, I'm not requesting anybody to do amazing pull-ups, but just even to use the bar and pull from up to bottom, that already increases our posture and improves our posture, sorry. So bridges, up and down, and then upwards rows, very simple to be done in the office. I hope in your offices there is a place and definitely the time to do it. Some small and not expensive equipment might be actually purchased for that. Very simple to arrange it. Rowing, you might do it in sitting as well. You might do it in standing. Postural strengthening, pull-ups. This is like very strong gentlemen for sure. But we can do also partially kind of strengthening of these muscles by even keeping our feet on the floor and just slightly engaging muscles that they are actually shown as a red color. So that already will improve our position. Overhead activities, we don't have to do it that often, but also a good idea to be basically upright. Yeah. And then almost done. Stretches, something that we can definitely do also when we sit. So we should stretch our neck, we should stretch our back. If you look at this gentleman, he is sitting on the right-hand side here. He is sitting on the stool and he's supporting himself. His left hand is not just hanging. Maybe it's not that shown well, but his left hand is stabilizing the whole posture. So he's holding that leg of the chair. Try to maybe do it yourself right now. So he's holding the chair, which is not allowing him to bring the left shoulder up when he's stretching the head to his right side. Yeah. So sometimes when we stretch only the head, the left, so let's say we're stretching to the right side like he's doing, the left shoulder is popping up and going up. No, but to prevent it, we can easily basically hold ourselves. Next one, that's actually the same from the different angle. And then you see that here literally he is holding the chair. So why not try to do it? Both sides, they might be slightly different in the range of motion, but definitely it's good to do it. So how to do it? Try to reach to your almost maximum range of motion. Don't give yourself pain. This is important, but you want to maintain it for a good 10-15 seconds. Yeah. And then change to the other side. Okay, stretches here. This lady, she's squeezing her shoulder blades, but she's effectively stretching her chest. Yeah, so this is more about that. Very simple to be done. And then these stretches are slightly different because here she is using the towel to support and not letting to elevate the shoulder. So it's a bit connected to the gentleman that he was holding the chair. And this is just different way of doing stretches. Yeah. So what bad ergonomics, again, they might lead to the muscle tension, headaches, jaw pains. This is quite interesting topic as well. Sometimes people, they have a lot of pain in the jaw, in also teeth because of the wrong neck posture. Neck pain, shoulder tension, postural discomfort, lower back pain, coccygalgia, which is basically sitting on the last bone of our spine. Sometimes for that we need to have some special cushion to sit on, and then leg numbness or shooting pain. So that might be all of this. They might be the results of the wrong sitting. So this is us. This is me, Andrew, Physio Dubai. More than welcome to write to me also on Instagram, because many of us were just on Instagram as well.
Thank you very much, Andrew. That was very informative and helpful for the team. I think even when we send this to the rest of the team that weren't able to make it to this session, I'll send through your details and your contacts. I think the presentation was also very self-explanatory, so that if anybody goes through it themselves, I think just off the top of my head, we were also thinking of printing out flyers for Eyewa and sending them some rollers, foam rollers and stretch bands, so that they can also use in the office when they have a quick 5 minutes to get up from their desk. So that was very helpful. Yeah.
That's great. Thank you. Thank you so much.
Thank you, Andrew. Thanks, Nikita, for organizing the session. Thanks you so much.
Everyone for attending. Thank you, Andrew, for your time.
I'm just stopping recording, so the recording is done.
Sure.
Thank you so much.
Thank you. Bye-bye.
Bye-bye.